Guys, this is Dr. Bhupesh once again for you all, doing couple of questions of reading for you. Again, the previous listening session, I will put it at the end of this video. Please listen to this video till end, and also please watch that listening session 2 times till the end, what I was teaching. Like in this second question, there were words like globalization has made dietary changes. Dietary changes has led to tooth decay. Then again, they were talking about diet. Then again, in the last, they said these dietary changes have a substantial impact on diseases like diabetes and dental caries. So most of the topic was covered with globalization, dietary changes, and declining dental health. So beyond doubt, you should do A. If you will overthink, again listen to that listening lecture. Please listen to that lecture. If you will overthink, you will go wrong. Don't overthink. We want easy questions to be right. For those questions, we have to think easy. If I consider the B option, they were saying dietary changes in the developing nations. Developing nation word was not given. And then negative health effects of Western diet. Western diet word was given, but it was only on one occasion. So that cannot be the most appropriate heading. Appropriate heading, I would like to go with globalization that has led to dietary changes. If I do only this C. But the problem of this paragraph is that they were not talking about the diet. They were talking about that globalization has made dietary changes. That is why it is more appropriate heading as compared to this one. They were not taking about, they were not majorly talking about Western diet. The main thing they wanted to say that globalization and that has led to changes in the diet. That there were diet changes which were happening. So as the countries become wealthier, greater preference of Western diet. That means diet is changing. So they were not concerned about Western diet. They were concerned about change of diet. That is what you need to understand. So make it easy. If you don't want to overthink, then obviously A is the answer. Then talking about question number this. Now see, always go for the keywords. I always call them adverbs. Adverbs means something that is different. In a way, new system. This is a noun under the system. What kind of system? New system. So whether adjective or adverbs should be taken care of in the best possible way. Because they are, if you do not understand what is adjective, what is adverb, that's okay. But understand this word new. This is a different word, new. So now under the new system of doctor appointments, a woman, what happens to a woman under a new system? Let's see. First, I need to find what is the new system. King, 41, 8 months pregnant, lie down on 4 armless chairs, together in the far corners of a conference room, compressive. Again, I'm looking out for main word. Even in the exam, I read it like this because I'm not concerned about these. I'm concerned about my word new. She lifts up her t-shirt, lowers her pants, watches obstetrician, gel on her big full belly as the doctor slides a fetal heart monitor across her skin. Strong isn't the only one listening carefully for reassuring sound of a baby's heartbeat. Gathered in the room with her are four equally pregnant. Now they were talking about the situation. They were talking about a scene where a woman was getting a checkup. It was simple. That fetal heart was monitored, this and this. Now the main things are happening. Gathered in the room with her are four equally pregnant women. That is the main change. That normally in the gynae department, we understand one woman, one doctor. But now this is something different. Four equally pregnant women, they all arrived as a group to have their obstetrics checkup together. So they are coming as a group. For American patients, now used to. This is what you need to learn, guys. Grammar. I always say, you will always say why Dr. BKM always emphasizes on grammar. Grammar is the thing that gives you the right hint. Without grammar, there is nothing. Please understand. For Americans, patient used to think. Used to means past. But what is the question? New. Patient used to think of a doctor's appointment as a private. Private means one-on-one, and the word is also given. If one-on-one word was not given, even then I understand the meaning of private. But they have made it easy for me that one-on-one affair. So patient used to think in the past that it is one-on-one. The idea is the idea of a room full of strangers, something as intimate as the progress of their pregnancy may seem strange. That is the present. That it is a strange thing that many women are getting the checkup together. But look at it at this way. Would you rather wait for an hour to see your doctor for 10 minutes or meet at a pre-arranged time and see the doctor along with 25 other patients? So the main thing they are saying, whether you want to go for old method, waiting for your doctor for 1 hour and then taking 10 minutes, or would you like the new method where you are with 25 other patients? So what is happening majorly in this case, please understand it's very easy. Majorly, what is the change? Again, if you do not read this, if you do not understand this past, then you will consider one on one as present, but used to means past. That is where grammar becomes very, very important. Under the new system of doctor's appointments, a woman has to wait a long time to see the doctor. They are saying they don't have to wait for long. Earlier, they used to wait for 1 or 2 hours to see the doctor. Has a short appointment with the doctor. Again, make it simple. A woman sees the doctor in company with several other women. So that is the thing that was happening. 4 equally pregnant women. And second hint was this. So that is what is happening in the new system. Please listen to this video 2 times. Again, don't make easy questions difficult. Please, again, I will read it for you. So what was happening? It is present tense, present indefinite, first form. She lifts up this, watches as the doctor slides, present tense. Isn't fully one, gathered in the room. This is a passive voice, that all the women are gathered in a room with 4 equally pregnant women. They all arrived as a group. That is what is happening. They are arriving as a group together. So that means a woman sees the doctor in company with several other women. That was the main thing. So this is how you do easy questions. If you will overthink, these questions will go wrong. Subscribe our channel, and if you are listening to Dr. BKM's video, watch one video 2 times. Please don't watch 2 videos in a day if you don't have time. Watch one video 2 times. We want to take this method, that do it with ease. Do it with ease to your heart, to your subconscious. We want that your mind should understand some questions are very easy and those questions should be right. If we will not overthink, we will pass. This is Dr. Bhupesh for all of you from Dr. BKM Institutes. Our contact number is 76967 34256. Thank you.